Hello and welcome to the Lancet Voice. I'm Niall Boyce, one of the editors based in the London office. Now, London is, of course, where the Lancet started just over 200 years ago, but it has spread its wings since. In fact, it's a truly global publication, a truly global family of journals. And reflecting this, I'm the only voice you'll hear on the eastern side of the Atlantic today, because in this episode, we're focusing on the Americas and specifically on health issues in Latin America. We have so much to talk about. So I'm going to quickly introduce my co-hosts and our very special guest. So hosts first, I'm joined as ever by my colleague and friend Miriam Sabin in New York. And from Rio, it's an absolute delight to welcome Taissa Villa, Editor-in-Chief of the Lancet Regional Health Americas, to the podcast. Hello, Miriam, and hello, Taissa.
Hi, Niall.
Hello, everyone. Nice to see you.
So that just leaves our guest, the brilliant Professor Marcia de Castro, and she is the Andelot Professor of Demography, Chair of the Department of Global Health and Population, Director of the Brazil Studies Program of the David Rockefeller Center for Latin American Studies at Harvard University. She's also Associate Faculty of the Harvard University Center for the Environment and faculty member of the Harvard Center for Population and Development Studies. So a person more suited to discuss the rich topic of health in Latin America, I cannot imagine. Marcia, welcome to the podcast.
Thank you. Thanks for having me.
So I wonder if we could start off with you giving us a bit of a sketch. What are the biggest stories in health in Latin America? And in particular, what's new over the past couple of years?
So I think one of the biggest stories is the spread of dengue. It's just getting worse year after year. In 2024, it's the worst year on record. And although there is a lot of relationships with climate, this also has to do with how cities are growing, lacking infrastructure. And so there's a lot to talk about this. A new thing, I would say, it's the expansion of Oropouche that has always been confined to the Amazon region. And I think it reached pretty much every country in the Americas, and even some cases got exported to Europe and to North America. And we also have all the burden related to non-communicable diseases, which is growing in part because the population is aging, but in part because some of the risk factors are getting worse. And I'll just name one: obesity and overweight. This is across pretty much every country. And then I guess the one thing we cannot leave out of this discussion is issues related to climate. This is not a possibility anymore. This is very much real. We had, I think, one of the worst El Nino in terms of consequences in 23 and 24. And we have another one around the corner in this year. So the consequences are varied, from droughts to floods to fires to everything in the middle. And it affects pretty much every single country in the region. So if you put all of this together, there is a lot to address in terms of how to respond, how to prepare, and how health systems can handle all of this burden.
So on top of those growing and chronic and escalating challenges, we also have acute challenges to resilience in health in the region. And the one which I'm specifically thinking at the moment, just before I got on this recording, I got a news flash from my BBC News app, which said that there are now 589 people are thought to have died in these earthquakes in Venezuela. And I wonder what the situation is in the region with these situations of acute disaster preparedness and response.
Yeah, so when we think of disasters, we have disasters that are hard to predict, like earthquakes. And then we have the climate related that if we have good early warning systems, we know that they're coming. In both cases, there are different things to address. One is how much are you prepared to handle those disasters? So have you planned, have you trained your workforce so when those disasters happen, you can quickly deploy people trained to address the issues? Do you have places to host the population that have been disabled, that lost everything? Or you're going to have some sort of arrangements that are not ideal and can put people under vulnerable conditions for respiratory diseases or other things? Also has to do if you have the legal mechanisms to deploy financial support quickly. Do you have agreements with other countries? Because some of those disasters cross borders, right? So they affect people in multiple countries. So this all is part of a planning that takes time and has to be in place when the disasters happen. If you don't have those things in place, the disaster comes and you have to make all those decisions on the fly. Some of them are going to be not good decisions, and you may not have the ideal workforce, you may not have the ideal resources, you may not have all the different goods that you need for those situations, and then the consequences will be much worse than they could be. The other side of the story that also has to do with preparation is infrastructure. So do you have buildings that are prepared for those disasters? So if you are in a region prone to earthquakes, and the classical example is Japan. The buildings go from one side to the other, but they don't fall because they are prepared for that. What we saw specifically in the case of Venezuela is a country that has been facing a political and economic crisis for about a decade, if we think about it. They didn't have the ideal infrastructure. Some buildings just completely collapse. The health system is not prepared at all. In fact, the health system was already struggling over those years. So then the magnitude of the consequences is way worse than it should be. And I'll give you another example quickly. I think it was last year, there was this massive cyclone in a city in the south of Brazil. Then what are they doing now? They are talking to some countries in Central America, in the Caribbean. They're prepared for hurricanes, and the new buildings will be built using that infrastructure. So that's the right thing to do. Did you need a disaster for this wake-up call? Probably not, but at least there was a wake-up call. So,
just to jump in on that point, because you've sort of addressed the issue in Latin America, but of course other regions as well, these great differences between countries and also within the countries on the ability to be able to respond, to be able to be resilient, whether it's for infectious diseases or a pandemic or a disaster, like what happened in Venezuela, or a conflict, civil strife. You're a demographer by training, I believe. Is that right? And I wonder, from your perspective, with that hat on, could you tell us a little bit more, paint us a picture of what these differences are like and what that means in terms of health in Latin America? Of course, it's a very broad region, but it would be useful. Thanks.
Yeah, if you think from a demographic perspective, so most of the countries in the Americas are aging and aging fast. Some are more advanced in the demographic transition, like Uruguay and Chile. But if you take the case of Brazil, the largest country, around 2044, 45, population will start to decline. So it's a very fast aging. So what are the consequences of age structure of a population when you think of those disasters? So if you have a much older population, how can those people quickly leave a particular area when you have a disaster? So that's one challenge. The other thing is if you have a lot of people with disability because of some of the risk factors, diabetes, high blood pressure, those people are also not very mobile. After the disaster, it can also be hard for them to move around. One, they can lose all the access to healthcare, and they may need regular checks because of their conditions. They're going to lose that. If you have a lot of damage on the streets, they probably are not going to be able to be mobile as well. So the chances that they can respond quickly is not going to be the same as if you have a much younger population. The other thing is if you think of other types of disasters like a massive heat wave, the people that are going to be most affected will be the older and the children. It's exactly the extremes of the age distribution. So there could be different consequences also depending on the age structure, because if you look at the mortality curve, the mortality will be higher at older ages, but there are conditions that can be exacerbated when you have some of those extremes or some of those disasters. So you're going to have excess mortality than you would have if the disaster didn't happen. Some countries are younger, but they also tend to be the poorer ones. They're in the early, earlier stages of the transition. They already have a larger gap in life expectancy, lower. So when you have those events, it can also contribute to increase further the gap. The pandemic was an extreme, and we saw what happened. Countries that lost lots of years of life expectancy, they're, recovering. But, I think we're not talking a lot about this, but I think the sort of elephant in the room is if we are really going to see a shift in other causes of death because of long COVID or things like this, it may not make a shift in the overall mortality, but it could make a shift in some causes of death. And this needs more long-term analysis to see if we see this shift or not. So again, each country is a story, and each subnational analysis of countries are also a different story. That's why it's important to look at data, to understand, to plan, and be ready when those things happen.
So what this is communicating to me is how complex this is, that it's a matter of the physical health of the population, the mental health of the population, the age of the population, the physical structure of towns and cities. And it's making me appreciate again what a complex job Taissa has as editor of Lancet Regional Health Americas. I wonder, Taissa, what are you making of this?
Thank you for recognizing it. It is. There's one point, and I apologize for shifting a little bit, but there's one thing Niall just touched a little bit, and I don't think we mentioned it, but it's the role of mental health as one of the biggest issues in the region, and compounding with NCDs that Marcia started to talk about, and the aging and the young population, because those are the extremes that are also compounding in the mental health. I was really struck by, around this time last year, PAHO had a report saying that the predicted cost of loss in productivity and health expanding for NCDs plus mental health for the region would be in the trillions, in the 7 trillions, which is basically the GDP for the entire region. And I wonder if this is also a topic that we should discuss a little bit, like how do we see the undervalue that's put it and underfunding in mental health as a huge problem in the region?
And largely neglected, Taissa, because we don't have enough services. Even we model those things, but what is the real demand? It's all modeled. We don't know. In some contexts, it's still stigmatized. It's a sign of weakness, so that's also a problem. I think it's starting to get attention, for example, in particular contexts, like in schools. I think COVID sent a message and people are starting to talk about this. It's connected to violence. So in some contexts, it's also been talked about because of the fear of people living in certain contexts. Another term that is being discussed now is the mental health associated with climate. Like children and adolescents, that when it starts rain, they panic because they associated the rain with the house flooding and they losing everything and having to start over again. So those things are now being brought to the table, to the discussion. But the truth is, if everyone that needs care on mental health suddenly would show up at health facilities, we don't have enough even to provide the care that is needed. So huge problem with many different consequences, but still, not with the full service being provided. And this is across the region, probably even beyond the region. So we have model numbers, but we don't know exactly what's the real demand.
Yeah, I guess it's that sort of eternal subject of resource constraints. And just to bring in you, Miriam, as we move to the north, there are issues of funding for research and health to do with changes which the US has made in NIH, PEPFAR, the Global Fund. I wonder, Miriam, if you could tell us a bit about that, and I'd be interested to know what Marcia makes of it.
Yeah, well, Marcia probably knows, and Taissa, this has been going on for some years now, where countries have been, to use the term, transitioning out of being, quote unquote, Global Fund country or a PEPFAR country in the region. But there are still very serious health concerns. For example, like in Peru and Bolivia, there is not just tuberculosis, but there is MDR, XDR, TB, so extremely multi-drug resistant tuberculosis. The issues in Central America, of course, with HIV, also TB, and then still the need, we were so close to trying to eliminate malaria in Mesoamerica. And so I have wondered, just about how some of these countries are faring. How are some of the marginalized populations doing with this? I mean, Marcia, do you know, have you seen that the countries are able to sort of pick up the mantle and take over truly in this transition process, or was it too premature? How do you see this might be going in the future?
So I guess the first point is that we all knew that all this funding landscape needed to be improved, but that's not how you improve things, by just cutting everything and not having a plan B. So I think it's important to mention that. We see more and more countries trying to build the internal funding more. I think we hear more and more stories from Africa. I was in Nigeria 2 weeks ago, and it's quite remarkable what they're doing. It's not that internal funds could not be used before, but then you create the situation that money was coming, so you fund internally other things. But malaria, for example, was relying on those external sources. So one is there's this movement of more internal funding. But I think one thing we have to do more, especially in the Americas, is collaborations between countries. And that's not just funding, but that's medicine. It's different goods that are produced in the region. It's knowledge. We have a lot of knowledge that can be shared across countries. We have similar health conditions, similar challenges. You mentioned TB. Well, there's TB all over the Americas. So you could have collaborations. I think in that sense, PAHO is really good. We have to remember that PAHO was created before the WHO. It works in a very different structure. Interesting enough, the US did not leave PAHO. And we don't talk about that enough, right? So they did not leave PAHO. And I'm more familiar with the malaria landscape, but it's amazing how PAHO is really bringing countries together, and there are great things happening. And I am very hopeful regarding malaria. There are huge challenges. Colombia and even Peru and the Amazon region, right? There are major challenges: mining, deforestation, security, drug traffic, you name it. But we are going in the right direction, and there are collaborations happening. So we need to leverage this potential anymore, because the truth is those countries are in the same boat. We share the same problems, and we have enough expertise and some local production, not all of it, but we have to rely more on each other. One challenge are the political alliances. We have to recognize this as well. Not all countries are going to be easy to make those partnerships, but honestly, if we have healthy partnerships coming up, the others will see that there's a benefit from that. So I'm a true believer of good examples being contagious. I mean, you can call me a dreamer, but I'm not the only one. So, but I think those things can work.
Just jumping on that really quickly, because you and Taissa are both from Brazil. You're both sitting in Brazil right now. Brazil, of course, has been a leader in terms of generic building capacity for drug production. There's space for more of that to happen in Latin America, or is this sitting very much still on Brazil's shoulders?
I mean, I think there is. I don't think that every single country will have the kind of production plants that Brazil has, but I think others could also have. And honestly, if you look the way Brazil did it, I guess he did it at the right time. If it was now, I'm not sure if it would happen the same way, but it was a time when, they put together a health system from a popular movement. Things are happening. Countries entering a democracy. There's this need to make those things happen. And I would say in the 90s, late 90s, Brazil could have become self-sufficient on drug production. And there was a slowdown, and it's not. And let's not forget that India produces 60% of the medicine for the entire world. That's dangerous. It optimizes, but it's also dangerous. And we saw this during COVID when India started having cases. There were no vaccines for anyone except for India. So Brazil could be even better. And for the past 3 years and a half, there has been another movement on technology and innovation. Let's see where this is going to go. But I think other countries could also have some local production. Not all of them, but they could.
So to jump back to something you said earlier, Marcia, about the idea of countries within the region, cross-learning and cooperation. But, politics is never very far away from health. And so I'd just like to bring in Taissa again. How do you find politics and health sort of combine at the moment in Latin America in particular? And how is that working in the sort of global context that we're seeing of some really major shifts in the past few years? I'd like to know what you think of that, Taissa.
Yeah, I think I mentioned this before many times, like the democratic backsliding in parts of the region can have direct health consequences. We've seen it in the past. We've seen it with COVID, not that far away from our memories. The political instability disrupts everything related to health systems and governance. So you can easily step back decades with like one or two bad decisions in specific moments. So it it's sort of like it's a yellow flashlight, I guess, the changes that we are seeing, and especially in South America, I would say. Marcia, do you have views on that?
So we saw this with Venezuela, right? 15, 16, it was massive disaster, what happened on health, and there were spillovers to other countries. So it affected other countries in South America way beyond just Venezuela. We're seeing what's happening in Cuba now. And Cuba was always a leader on health, the amount of investment they did. And it's a massive disaster, major cuts of energy, people don't have enough infrastructure. That's interference, from the US. And it also brings a question of sovereignty, which is important. Then we have Haiti. Again, disasters after disasters, political crisis, and it's always one of the countries with the lowest life expectancy, malaria, TB, you name it. Everything is in there. So, and honestly, we have Brazil that had 4 years of a government that didn't trust science, didn't really care about the SUS, and on top of this, we had the pandemic, but there were other things that we had major problems related to health. And it's not just health per se, but it's decisions that affect health. One of them is all the relaxation of environmental protection that happened, and then the expansion of mining, and then the entire world saw what happened in the Yanomami region. So politics is directly connected to health. And people can say what they want, but public health is political, not because you need decisions, but because, alignments that people make can have direct consequences for health. That's true for our region. I mean, if you look at Latin America, we transition between governments that are very democratic to dictatorships. That has been our history since forever. And this has consequences, particularly regarding inequality. It's not by chance that Latin America is the most unequal region in the world. It has to do with that as well.
So one subject which I think I'm interested in learning more about is the issue of indigenous health in Latin America and how equitable care can be built in what I'd call respectful collaboration with, diverse views, opinions, populations, how those things can be brought together. I mean, I know, Taissa, you've covered a little bit of this in your journal, or quite a lot of it in your journal.
We try, but one of the things that we have a lot of difficulty with is the data. So we have anecdotal data, we have like small pilot studies, or you have like different community studies, but the picture of indigenous health across the region is really difficult to get. But it's definitely a topic that we're absolutely interested in. And one of the things that discuss a lot is how to deal with the definition of health, because it's a really sensitive topic to import or to try to enforce what we define as health and not respecting what indigenous peoples define as health, because it's much broader and it's bigger than the absence of disease, for example. That's like our definition of health. But for them, health is much more than just the body. It's the environment. It's really connected to the land. And then it goes back to what Marcia was saying, like decisions to expand mining and demarcation of indigenous previous, right to the land. Those are political decisions, but that affects health of those people without recognizing their rights. This is a really, really sensitive topic of how do we expand healthcare provision in a way that's actable, as you said, and actable is not equal for everybody, right?
Yeah, but in that sense, I think there are some initiatives that we probably need to highlight. For example, in Brazil, in Manaus, that's the capital of the largest state in the Amazon region, they opened a health facility which has 4 different teams of primary care. And this is the first indigenous adapted health facility in Brazil. And what does that mean? It's open in a neighborhood that it's the only indigenous neighborhood in an urban environment in Brazil. It started as sort of settlement of indigenous groups that came to the periphery of the city. And now it has 32 different ethnic groups living in there. And the name of the neighborhood refers to, in Portuguese, it's called Parque das Tribos. So it basically says it's a collection of different ethnic groups. In this health facility, when you enter, there are 2 people that welcome you. They're indigenous, and it's supposed to welcome you in your language. And then you can have the traditional medical care, but you can also have the healer, the traditional healer from the indigenous community in a room that can provide you the traditional care based on their knowledge, using herbs that are in the back of the facility in a little garden. So that's one example on how you can adapt. You give a choice. You can go either way. You can go to both. It's up to you. But you are welcomed by somebody that speaks your language, that you identify as well as indigenous. Now, we still have a long way to go, but that is a super start and sends a message that you can do it. If there's willingness to do it, you can do it.
Yeah, and that speaks to I suppose, my experience, which is in some ways not related at all, which is of health in the UK. And that's that when I was in practice, you see people coming into a primary care clinic, you see people coming to hospital, and they're looking around for a friendly face, I'd say, is the more or less a universal experience of having problems with your health. You're looking for that sort of warmth and human connection and care. And it sounds as if this is what these clinics are really providing, as well as all of the other wonderful things which they're doing.
Yeah, you feel like you belong, right? You belong in this place.
I think if I can jump in, it starts to address another problem that we didn't have, but we created, which is trust in vaccines. And we lost that. And trust also has to do with you feeling like, you recognize yourself in the other person, and therefore you trust what they're saying. And we start to rebuild that.
Yeah, so if you look at countries like Brazil that have always been a model of vaccination, pretty much every vaccine coverage was above 95%. People are always ready to go to the health post and take a vaccine, and that was never an issue. This, I guess, started to deteriorate around 2017 or so. There were a few things. There were groups, small anti-vax groups that started to come into the country. We had the changes in the time when facilities are operating. So if it doesn't open on a Saturday, how can a mother bring? So there were also challenges on being able to go. Then there was the entire context of the funding cuts that we had when the budget was pretty much frozen. And then we had the denial government that then helped to spread this misinformation about vaccines. So now we are increasing, but we're still not there. I mean, if you look at the numbers, the coverage, it's better than what it used to be, but we're still not above 95 in every single vaccine. So just to give you an example, when the measles came back, So Brazil was certified measles-free in 2018. Then it came back. Why did it come back? Don't blame the Venezuelans, because if our vaccine coverage was high, we wouldn't have the outbreak we had. The problem was that the coverage was low. So it's going back, but it's going back slowly. And that goes back to something Taissa said. It's very easy to break confidence, but it takes forever to rebuild it. And it's gonna take some time. And we have particular groups where leaders of those groups, some of them are religious, they are the ones saying that vaccines are not effective, people should not take vaccines. We have leaders of countries saying this, and all this information is going around. I can genuinely understand how some people may get confused and not know what they should do. It's not because they are bad people. Some people, honestly, don't even know anymore what they have to do and if they should get the vaccines to their children. So it's a complicated situation. It took time for Brazil to get that coverage level. It's going to take time again to rebuild. The rebuild is always much longer than destroying. We are in this path to rebuild, and I hope we can continue. We have elections this year, so we'll know where we're going to go. But it's still a challenge.
So we always like to have at least an element of optimism in these podcasts, don't we, Miriam? We like to be optimistic. And I guess one of the things which we were talking about earlier was ways in which Latin America is actually leading the world and what the big success stories are from the region. I think, Taissa, you mentioned Chile's front-of-pack food labeling, for example, which is now shaping policy elsewhere with regard to these consumer laws promoting health. I wonder, Marcia, if you have any examples of where this region is really a world leader.
I guess I'm going to be biased. I mean, if I use the case of Brazil, the SUS is a lesson. We have no other country with more than 200 million people that has a free, universal health systems, and 75% of our population depends solely on the SUS. It's a model. It's discussed in any university that is talking about health systems. Brazil is always there. The SUS is always there. It's an inspiration for other countries on how to do primary care, on how to try to achieve universal coverage. So it's not perfect, but it is a model, and it's revolutionary. So that's one thing. Connected to the SUS, Brazil was absolutely pioneer in setting up milk banks. And it's a model for other countries on how you set that. Imagine how many lives of babies were saved because we have the milk banks. It's beautiful. And I'll give you another one. The system of transplants in Brazil, the system itself, it's all public. No other country makes more transplants in the public system as Brazil. And it doesn't matter how much money you have in the bank, you still have to be on the line to wait for your new heart and your new kidney. That's beautiful. So I think those are models that other countries look at, that any student anywhere that is studying health systems, strengthening resilience, they always are going to discuss the SUS. And I think we should talk more about this, because you look at some people probably in the region and they just ignore it. They think it's not good enough. Oh, it is. We have to make it even better.
And it becomes politicized too, doesn't it? So in the United States, of course, we have a lot we could learn from this. We don't have universal health coverage, and we certainly don't have that many transplants going on, I think, in some public health sectors. But unfortunately, that's an element that comes into play, doesn't it?
It does. When people ask me how you compare the health systems in the US and in Brazil, I'm like, I can tell you about Brazil. I don't think we have very good health systems here. And just to give one simple example, the Brazilian students, when they go to the US, they're always afraid of needing care and calling an ambulance, because in Brazil, it's free. But in the US, you pay a lot. And when I bring students to Brazil, because I always bring students in January to Brazil, they are like completely shocked that you don't pay for an ambulance. Or, oftentimes somebody gets diarrhea, whatever, and I take them for care, and they always ask, how much do I pay? I said, nothing. You just get better and come back to class. And they're always surprised that they don't have to pay anything. So, it's nothing like experiencing it firsthand, so you can see the importance of it.
Yes, I was going to say, I asked for optimism, and you've more than delivered that, Marcia. Thank you. So I wonder, looking forward, what's your greatest hope for health in Latin America over the next decade?
Look, I could give you a list of wishes. So I'm just going to mention two. One, I hope that all the movement that started after the last COP, which was, I think, a very different COP, at least the president was not connected to the oil business. That's, very good. And the fact that they're working on these pathways for change. So I'm still hopeful that something can come out of this. More very specific related to health, I am hopeful that everything that PAHO is spearheading towards malaria can put the region really in the right path for elimination. And honestly, the last country to eliminate malaria in the Americas was Suriname. It's a small country, I know, but it's a country that has mining, has all those challenges, and they did it. So I think, and I hope we can have more countries eliminating malaria in the Americas, and that's an inspiration for other countries as well. So I'm very hopeful on that.
Thanks, Marcia. Miriam, great to talk as ever. Taissa, fantastic to have you on the podcast. I hope you'll return soon. And also thanks to you, the listener, as well. I hope you've enjoyed this episode. Please do like and subscribe, as they say, and we will get you a podcast every couple of weeks on a really wide and fascinating range of topics in health. So I hope you'll join us again next time. But for now, goodbye.